Hello, I'm Dr. Michael Teplitsky. I'm a medical doctor. I practice internal medicine, alternative holistic medicine in New York for over 30 years. This is part 3 of our series about natural hormone replacement for aging people. So in part 1, we talked about hormones, what they do, why they're important. Part 2 was about natural hormone replacement for women going through menopause. So be sure to check it out. And part 3 today, we'll be talking about natural testosterone treatment for aging men. Testosterone is called a male hormone, although both men and women have testosterone. And it does the same thing in both. It makes everything stronger. It makes stronger bones, stronger muscles, immune system. It improves sex drive. It improves orgasms. And in men, it also stimulates the production of sperm. It's produced in the testicles in man, in ovaries in women. Young men have high levels of testosterone, but as men get older, their levels drop. And there comes a time when the levels become too low and they develop certain symptoms. They become weaker and more tired, and they have mood swings and even hot flashes like in women who have menopause. In fact, we call this phenomenon andropause. Andro means male, so andropause is like a male menopause. Their muscles become weaker, their bones become weaker, and they develop erectile dysfunction. They cannot get an erection, so they cannot have sex. So they go to their doctor, and the doctor checks their testosterone level. Now, in the lab that I use, they say normal testosterone level for men over 17 is 280 to 800, which means that if your level is, let's say, 400 and you're having all these symptoms, the doctor will not treat you because they say you're normal. 400 is normal. Well, there are many studies where they take healthy older men without any symptoms, they're feeling fine, healthy older men with levels of about 400 or less, and they give them testosterone to bring it up to the youthful range of 700-800, and they find that these men get better. They feel healthier, they feel stronger. Their bones become stronger, their muscles become stronger, and their mental acuity improves. So it seems like it's good for a man, regardless of age, to have high level of testosterone. Okay, so the problem is many men do not get treated because their levels are not low enough for their doctor to prescribe them testosterone. And another problem is that for many years, decades actually, doctors have been giving men with low testosterone unnatural testosterone, a synthetic preparation of testosterone, which doesn't work exactly the same way and in fact can cause many problems. But fortunately today, we have natural bioidentical testosterone that any man can get by prescription, of course. And there are many preparations that are available. You just walk into a pharmacy and get it, like Androderm, Androgel, Axiron. There are many others. But the problem is they're very expensive. If your insurance doesn't cover it, it costs about $400 or $500 a month. So what I do very often for patients who do not have the insurance that covers these medications, I give them a prescription to a compounding pharmacy, which can make the testosterone cream right there in the pharmacy, and they dispense it, and it costs, I don't know, $30, $40, $50 instead of $400, $500. There is another problem also. When men get older, they develop a condition where their testosterone turns into estrogen. Estrogen is a female hormone. Men have some estrogen, but they shouldn't have too much of it. And if they do, it leads to all kinds of problems. So when you treat men with testosterone, you need to make sure that their estrogen level does not go up. So I generally do blood tests where I check both testosterone and estrogen to make sure that estrogen is not too high. And if it is, then I give them something to reduce it. So this is the problem. Men are getting older, and many men have low testosterone level. Not low enough for their doctor to give them testosterone, but low enough so that they have the symptoms that I mentioned. And if you are in this position, call me. I've treated thousands of men over the years with low testosterone, and I know how to deal with that. So call my office, 718-769-0997, to arrange a phone consultation. I can arrange for you to have a blood test where we can check your testosterone, estrogen, and everything else. And then if you need to have treatment, I'll provide it. 718-769-0997. 718-769-0997. Don't forget to like this channel, to subscribe to it, and don't forget to watch part 1 and part 2 of this series. I am Dr. Michael Teplitsky, wishing you the best of health.